Hi there. Welcome to my channel, Heal My Pelvic Pain. This channel is dedicated to anyone who is struggling from non-bacterial prostatitis or chronic pelvic pain syndrome. In this video today, we are going to talk about the pelvis anatomy. We're going to talk about the organs, the tissues, the muscles in the pelvis, and how all of that is actually interrelated with the symptoms. And as a first and a very important step in the healing journey is to really understand the pelvic floor, the prostate, and all of the organs within the pelvis that is going to be critical as you try to heal from your chronic prostatitis. So let's dive right into it. So what I have here is I'm showing a male model for the pelvis, and I'm showing you here the bones here. You can see the pelvis bones. So I'm going to rotate this so we can actually look at it from different angles. So here you can see these are the sitting bones and the buttocks area here. And here you can see the prostate. And as you can see, right on top of the prostate, you'll have the bladder sits right on top of it. And the urethra, which the urine comes through, actually runs through the prostate, right? So it runs through to the penis. And here you can see the male organs as well. So this is a view of the kind of the key organs that are involved. So when we're talking about prostatitis or chronic pelvic pain, is really essentially focusing on the prostate as being something that it's inflamed or having a problem, right? So this is here, you can see like a zoom view of the prostate, and you can see how very close the prostate is sitting next to the bladder. And we're going to talk about this and why this is important. So if I zoom out here, so let me just zoom out, and I'm going to now remove all of the bones here from the view. And I'm going to add the pelvis muscles here so we can see the muscles all together. So now you can see all of the muscles together. That's probably is going to be too much of a view, but I will just kind of strip out and just really just focus on the pelvis muscles only. Okay, so here we can see the pelvic floor muscles. So you can see the prostate here, and you can see the muscles that are surrounded. And you can see here, the pelvic floor looks like a bowl, like the shape of a bowl. And essentially, its function is to protect the reproductive organs, the prostate, the bladder, and plays an essential role in the movement, the balance, and other key functions within, and as well as sexual function. So it's a very, very small group of muscles, but very powerful and has a very delicate and critical role in our day-to-day life. So here you can see, and what you can see here is like how I'm going to just zoom in, like how closely the prostate is sitting right on top of the muscle. See here? It's very critical to understand this. So when we're talking about the pelvic floor, it's not just one muscle, it's a group of muscles, and they're also connected with the prostate, but they're also connected with the reproductive organs and the penis. Here you can see the rectum and the muscles around the anal opening. And you can see here also a large number of muscles that are all interconnected. Okay, so we've covered now the organs, we've covered the pelvic floor muscle, and we've covered the reproductive organs as well. Now I would like to add and show you the nerves in this model, nervous system. Okay. So when we add the nervous system here, you'll see a lot of nerves, right? And this is not surprising. So I'm just gonna remove the pelvic floor muscles for a little bit, just so we can actually see, the nerves. So here I remove the pelvic floor, and here you can see the nerves that are surrounding the prostate. So even though it's a very small organ, but look at the number of nerves that are surrounding this small organ, so as the bladder. And why is that? Because this is a very sensitive organ and it plays a big role in sexual health, and the area is very sensitive. And you can see that the nerves here, the network of the nerves are very extensive. So this area has a lot of sensory signals that goes all the way to the brain that controls everything from our movements to our mental state to our pain levels. And it's no surprising when there is a problem in this area, you can feel it right away and you can feel the pain can be unbearable. And you can see all of these nerves are actually running through the muscles. So if I put back the pelvis muscles view, all of these nerves are surrounding and intertwined within the pelvic floor. And then when I add the remaining muscles also, the movers muscles that are surrounding the pelvic floor, you can see that all of these nerves are also very, very intertwined as well. So I wanted to explain this concept because it's very critical to understand how is the pain is actually being triggered and how is it being actually intertwined with the muscular system. All right, we covered the nerves. So let's go through now some of the prostatitis symptoms and how are these kind of linked to when we're talking about pain, because all of the pain is transferred through these nerves. So what are the common prostatitis symptoms? So the first or very common symptom for prostatitis and chronic CPPS is urinary problems. So it could be voiding, could be burning sensation. So you can see here, all of the issues around burning and sensation are linked to the pelvic floor. So if the prostate is irritated, it's not very far from the male organ tissues and is not very far from the bladder. So these nerves can also get irritated and they can send pain signals to the brain. The same thing with the urethra, right? So the urethra is very close, and if any of these nerves are irritated in this area, it can also trigger. And remember, the urethra runs through as we shown earlier, runs through the prostate. Irritation in the prostate will translate into irritation in the urethra. What are some of the other symptoms? So sitting pain. So sitting pain in this area here in the perineum, you can see these muscles are all part of the pelvic floor. So if there's any irritation here, there's any spasm, this pain can be triggered and you're going to feel it right away. You can also feel pain in the buttocks area and then pain in the legs area. And you can see these are the big sciatica that are actually running through the legs. So I wanted to talk about some of these symptoms as very common and very common and interrelated with the pelvic floor. So let's move on now to the big movers muscles. So what are the big movers muscles that are surrounding the pelvis? So if I put back all of the muscles, you can see here, this is the view with all of the muscles are back in. You can see there's a lot of muscles that are surrounding the pelvis. One of the challenges with the pelvis is that it's covered. It's not something that if you have an injury in your arm or your biceps or in your chest, you can work on them. You can treat it because it's exposed. But for the pelvic floor, it's completely kind of covered. What are the big muscles that the pelvic floor? So one are the glutes. So you can see these are big, powerful muscles that surrounds the pelvic floor. You have the hamstrings, and you have in the front, you have the adductors. So these muscles are directly linked to the pelvic floor. And then you also have your quads. And then and then you have your abdominal muscles. So you can see also the abdominal muscles actually goes all the way to the pubic area. And you also, behind this, you can have also the psoas muscles, which are not showing. So I'm going to peel some of these muscles here so then you can see more. So you can see multiple layers of each one of the muscles. So here you see this is still part of the abdominal muscle. So this is another deep muscle. And here you can see the psoas muscle. So this is another powerful muscle that taps the upper limbs to the lower limbs, and that runs through the pelvic floor. And if we peel out, let's go here, and then let's peel out some of the other muscles here. So we can peel out the glutes muscle. So you can see the first layer we peeled, and here you can see the piriformis muscle. And this is a very powerful muscle that controls some of the movements within the leg. And you can see this muscle is actually, the sciatic nerves runs through this muscle. So if this muscle is tight, it will apply pressure on this big nerve, and you're gonna feel pain in this area, but also in the legs. So let's peel this one as well. And you can see layers of muscles that are also, and we can peel some of these as well here. In the hamstrings, you can see there are layers of muscle that are surrounding the pelvis. So these are the, let's peel these ones here as well. Let's peel this one as well. And this is also another muscle that is part of that adductors. And you can see how this is actually linked to the pelvic floor. So that covers the big movers muscles. We are not, now we're talking about, so what's causing all of the pain and the symptoms, and what are the triggers? So some of these causes are muscular related. So the muscles themselves are causing the issues, but some of them have not been triggered by the muscles. Could be something else. We're not going to get into that. This is a whole different topic that we are going to be talking about: the symptoms, the triggers for these symptoms, and then the tight interrelationship between these triggers and the muscular systems. And all of that is going to be as part of the treatment that I'll have more videos on. If you want to see more details, you can check out my website. You'll have the link down below in the description. So that comes to the end of this tutorial. I hope this was helpful. I hope this was informative. Thank you for your time. And don't forget to like and share and subscribe to the channel to share the knowledge and spread the word for anyone who is struggling from CPPS. Thank you.